Yes, good morning, everybody. My name is Andreas Brüch, and I will present today about Korean SaAm acupuncture. Time is short, so let's just right away jump into my presentation. I'm going to share my screen with you. Okay, my presentation is about Korean SaAm acupuncture, and as a Korean medicine in general has the specialty of setting a focus on constitutional treatment, I will try to explain to you how Korean SaAm acupuncture is using constitutional aspects in treatment. And it basically is linked to the theory of the 6 Qi and the 5 elements, and comparing SaAm acupuncture with, how can I say, standard TCM acupuncture. There is some special focus in this acupuncture style, and that is the theory of the 6 Qi, or the 6 climatic energies. At first, I have to say, usually my basic introductory course for SaAm acupuncture is 3 full days for people who have a already TCM training. So I had to strip my presentation of many finer aspects of SaAm acupuncture to make a general overview and give special focus on this constitutional treatment. So I hope you will have a good understanding of it, even if I had to cut away many of the finer issues of this theory and acupuncture style. My presentation will have 2 main aspects. I will give you a short introduction and a short walkthrough in general through SaAm acupuncture and its basic theories, and then I will introduce you to some constitutional aspects that can be found in this 6 Qi 5 element theory and how it is being treated. Okay, before we go further into details, let me say a few general sentences about SaAm acupuncture. The name of this acupuncture style comes after the founder of it, Master SaAm, who was a Buddhist monk living in Korea. He left one written manuscript that must have been, from historical conclusion, it must have been written between 1644 and 1742. And since that time, SaAm acupuncture has evolved in Korean medicine. SaAm acupuncture is sometimes referred to as 4-needle acupuncture because most of the treatment strategies that Master SaAm left in his manuscript were comprised of 4 needles, and I will explain later in my presentation what this principle is all about. And I want to introduce you to a second person in SaAm acupuncture, that is Dr. Kim Hong-kyung. He's one of the modern founders. He took SaAm's manuscript and made his own interpretation of what he has been writing, and my presentation will be basically about his understanding of SaAm's manuscript and SaAm acupuncture in general. He actually further developed that traditional 4-needle style method and introduced another method that it is called Sambu acupuncture. That is a even more strictly constitutional treatment than this, how can I say, orthodox 4-needle method that I will speak about today. So it's a kind of advanced SaAm acupuncture, but since the basic model is this 4-needle treatment strategy, this is what I will present about today. And we cannot go further into this also very interesting model of Sambu acupuncture. Okay, in this SaAm acupuncture 4-point needle method, we can say there are 4 basic treatment strategies, 1 tonification and 1 sedation strategy that is called Chongyok and the Seungyok in Korean, and also 1 cooling and 1 warming strategy, again, for making it more simple and for introductory lecture, we have to keep the cooling and warming strategy outside of my presentation today. And I will speak mainly about tonification and sedation strategy as a treatment method. The tonification strategy is called in Korean Chongyok, and the sedation is Sungyok. And I will also refer to these two terms as, strictly speaking, we cannot only say that tonification is just only tonifying a meridian and sedation only sedating, because it's always comprised of 4 points. 2 of them are tonifying, get tonified, and 2 get sedated. So strictly speaking, it's not only tonification and sedation. And to avoid a little bit of this confusion, I'm also using these 2 terms, but we cannot go deeper in the general theory of why and how is what is the difference or the speciality of these tonification and sedation strategies. Just no time for it, I'm sorry. But I want to give you a short overview of the point principle. The points are generally all chosen from the 60 shoe transport point, or the 5 element points, the so-called antique points. We are always having 4 points in one treatment strategy, and these points are utilizing, or the selection of point. The logic is utilizing the promoting and controlling cycle of the 5 element theory, where 2 points are chosen according to the promoting cycle and 2 points are chosen according to the controlling cycle. This is the one aspect. The second aspect is, as I said, 2 points are tonified and 2 points are sedated in every treatment strategy or point protocol. And this orthodox SaAm acupuncture method is a unilateral application. That means those 4 needles or 4 points are only applied on one side of the body. And on the other side, well, the other side is basically free for additional or other treatment, you can choose other points with whatever theory that might be appropriate. For example, we can make a root treatment on one side of the body with those 4 points and use some more symptomatic points like Archer points, for example, on the other side of the body. So this means SaAm acupuncture has for every meridian a fixed set of 4 points for tonification and sedation. And with these points, we can basically treat 4 different kinds of diagnosis or 4 levels of treatment. We could use these 4 points for a channel treatment where we treat a local problem. For example, you have a tennis elbow and the problem is along the distribution of the large intestine meridian, and you pick the needle combination for tonification of this meridian and treat the problem with it. The second level would be like a normal TCM, Chinese medicine, Zhang Fu related diagnosis, and you can use these 4 needles to treat that diagnosis. For example, if we take the liver, you can divide every diagnosis in Chinese medicine basically to a liver excess or a liver deficiency diagnosis, and then always use the same 4 needles for all diagnoses that fall into the category of deficiency, for example, in the liver, and treat them with the liver tonification strategy, with liver Chongyok, or all diagnoses that would fall into the category of excess, and treat with the sedating or dispersing strategy of liver Sungyok. And you can do this for all 12 channels. So this is like normal Chinese medicine, I think, in the theory and diagnosis. And we have a 3rd and a 4th level that is a specialty to SaAm acupuncture. One is if we can make a diagnosis of imbalanced internal climatic conditions, the so-called 6G, and we can treat it with those 4 needles. And there's a 4th category of diagnosis and treatment, that is mental emotional issues or problems, because Dr. Kim Hong-kyung set up his own theory of mental emotional problems and idea. And it's called Mind Path Meridianology in translated in English. But also for time restraint, I cannot speak about this this method today. And as I will focus on constitutional treatment, we can make a kind of constitutional typing by using the 6G model for clinical treatment. Okay, and in this 6G model, as I said, we have one clinical principle, that is, we have a balancing pair of meridians where we may find in diagnosis, even as a pathology or as a constitutional characteristic, some climatic energy in excess. And we can basically balance it by tonification of the opposite climatic energy to balance the person, and in that way to treat the disease. Okay, now let's go to some basics of 6G theory to make you understand how the model works. The 6G or 6 climatic energies are basically explained in Huangdi Neijing So-Wen chapter 68. It is the comprehensive discourse on the subtle significance of the 6G, but I cannot go deeper into any references of the classic literature. Let's just go and jump right directly into the theory. Okay. In 6G basic theory, each meridian has an associated climatic characteristic or meridian energy that we can use for clinical treatment and therapy. And the 6G are here on this chart. It's a Tai Yin, Yang Ning, Shao Yin, Tai Yang, Jue Yin, and Shao Yang. And many of you will know these terms from the Shang Han Lung and Chong Jin's theory of the cold diseases with the 6 levels. But the understanding in SaAm acupuncture and in 6G is a little bit different of the same identical terms. Okay, Tai Yin in 6G is representing dampness. Yang Ning is representing dryness. Shao Yin is representing heat, and the source of the heat is the sovereign fire in 6G theory. Tai Yang is representing cold. Jue Yin is representing wind, and Shao Yang is representing, Shao Yang Qi is representing also warmth or heat, but the climatic energy where it comes from is understood as the energy of light, and the source is the ministerial fire. I think the first 4 are quite clear. I have to say a few sentences about Jue Yin and Shao Yin Qi in 6G theory. Jue Yin is considered wind, but the wind is considered mainly in 2 aspects. First, wind is a very strongly moving energy, and the analogy for the wind also is like a tornado or a wind hose that is circling with a lot of energy. In that way, is building like a inwards drafting energy. So the Jue Yin energy first is a very strongly moving energy, and second is something that is astringing and pulling things inward and also lifting them up a little bit. And the Jue Yin energy, since it is a strong wind, has like a cooling temperature. The Shao Yang energy, the analogy is like a light bulb or a fire that is warming and is radiating energy outwards, like a ray of light that is starting from a fire or a light bulb outwards, and it's a kind of warming since it is light, in that way can also warm, how can I say, external objects. So the Jue Yin and Yang, Shao Yang are opposite energies. Wind is cold, drawing inwards and moving, and Shao Yang is like a light, is the outward moving and is a little bit warming. Okay, and if we, in the next step, divide these 6 kind of climatic energies into 3 dimensions, we will find 3 pairs of opposing climatic energy. The one dimension is dampness, where Tai-yin is the damp element, and Yang-Ming is representing dryness, and they are balancing each other. Temperature dimension is Shao-Yin with heat and Tai-Yang being cold. And the dimension of movement is the Jue-Yin is the inward moving, cooling energy, as I said right before. And the Shao-Yang energy is a kind of dispersing outward centripetal energy that is going outward. So we have a cool, astringing energy and a warm, distributing outwards kind of energy. So these are the basic pairs of energy in 6G theory and SaAm acupuncture. And from that, we can go one step further, which means that we have these 6 energies, but we have 12 main meridians, and every meridian we can divide the meridians, and every meridian will have an individual climatic characteristic that is coming from the combination of these 6G climatic factors and from the from the theory of the 5 elements, and from the Zhangfu theory and their corresponding climatic energy. Yeah, that means, for example, the spleen meridian has the climatic factor of Tai-Yin, as it is the foot Tai-Yin spleen meridian, and the Tai-Yin is dampness, and spleen is representing also the earth element, and the earth element is also damp and a little bit warm. So we have dampness from the 6G and dampness from the 5 elements that combines to a very damp climatic energy. And in SaAm acupuncture, we just have to assume that the 6G climatic factor is a kind of dominant over the 5 element theory, over the 5 element aspect of a meridian and Zhangfu. I cannot go deeper into why it is like that, because it will need too much time. We just have to assume this as a given fact now. Okay, this now, if we combine the 6G and the 5 element, is the chart of the balancing meridian pairs. As you see, we have 3 dimensions again: dampness, humidity, dampness or humidity, temperature, and movement. And we have 4 meridians in each of the dimensions, where one meridian is always balanced by another. And this just charts the balancing meridians that are how they are in their climatic energy by the combination of the 5G and of the 6G and the 5 elements. Let's make the first example. As I said before, foot Tai-Yin spleen is the combination of the Tai-Yin dampness in the 6G and the earth element of the 5 elements. So that means it's dampness plus dampness, which is a pure dampness, and it has like a warming temperature aspect, since the earth element is also a little bit warming in its climatic energy. And the opposing meridian is the large intestine meridian, which is Yang-Ming, large intestine. Yang-Ming is representing the climatic factor of dryness, and the metal element represented in the large intestine, Zhangfu, is also dry. And as you all know, metal element also has a kind of a cooling aspect. So it is dryness plus dryness and somewhat cooling temperature, which is dry and cooling. And these 2 meridians are balancing each other. And this is a climatic factor that is pure. We have 6 pure climatic pure meridians, and six that are mixed. So let's make a mixed example. The Tai-Yin lung meridian is representing Tai-Yin dampness, but the lung is metal and dry. So we have actually a mixing of dampness and dryness. But as I said, we assume that in 6G, the 6G factor is dominant. So Tai Yin lung meridian has, in SaAm acupuncture understanding, a damp promoting effect. But since metal element is cool, it's a damp cooling. And the opposing balancing meridian is the stomach, which is a Yang Ming climatic energy, that is dryness, and combined with the earth element of the stomach. So since I said the Yang Ming is dominant, it is a drying meridian that has from the earth element a warming aspect. Okay, and if we compare always the pure meridian, pure energetic meridian with the mixed ones, obviously the spleen meridian is more damp than the lung meridian, and the large intestine energy is promoting more dryness than the stomach, but their temperature aspect is different. And this is very similar in the temperature dimension. Heart meridian is Shaoyin heat with fire element combined, so it's pure heat. Bladder meridian is a Tai-Yang cold combined with the water element of the bladder, Zhang Fu 5-element aspect. So it's cold of water and cold of Tai-Yang, which is pure cold, and these two are balancing each other. Kidney and small intestine is a little bit special issue. The foot Shaoyin from the sovereign fire in the Shaoyin aspect is combined with the water of the kidney. So we can say, since the kidney is the basis of yin and yang, it has both together, hot and cold. And the small intestine balancing meridian is a Tai-Yang coldness combined with the small intestine fire element, and it's mixed together. So it's a little bit from temperature lukewarm or mildly warming and cooling. The special aspect in the understanding of small intestine in SaAm acupuncture is that is related to the blood itself and can treat blood-related problems. But I cannot go deeper into this one right now. In the third dimension of movement, we have two purely moving meridians, as I also already introduced before. The liver is Jueyin wind combined with the wood element of the liver, which is also wind in climatic energy understanding. So it's wind plus wind. So it's a purely very strongly moving inwards drawing and astringing, slightly cooling kind of climatic energy. And the balancing meridian is the Sanjiao, which has the Shaoyang light that is outward moving and is combined with the fire element. So it's an outward moving, expanding energy of warming light. And the two mixed meridians here is the pericardium, which has the Jueyin wind aspect and the fire aspect of the pericardium 5-element aspect. So it's a like mixed inwards and slightly warming energy. So we have two inwards moving meridian energetic aspects. Pericardium is moving inward and warming, and Jueyin is moving and inward drafting and cooling. And the gallbladder meridian is another specialty in itself because it shares the Shaoyang aspect of light, which is moving outward, and the wood element, which has a astringing and inward pulling energy of wind in the understanding of SaAm acupuncture. But so it's a little bit inward and outward. But in the balancing scheme, these two meridians are also balancing itself. Okay, this is the basic model. And let's move on. Yes. I want to shortly introduce you now how those 4 points in SaAm orthodox 4-needle strategy are set up together. They are following actually the promoting and controlling cycles. So 2 points are selected according to the promoting cycle, and 2 are selected according to the controlling cycle. So for example, if we want to boost the spleen's energy, climatic energy, the promoting cycle says tonify the mother, which would be the fire point on the spleen meridian, and this is the second point of the promoting cycle, the element point or house point of the fire meridian. In that case, it would be spleen 2. So we tonify the fire point on the earth meridian, spleen meridian, and the fire point on the fire meridian. And the controlling cycle is that to give the spleen in the earth element more freedom, more energy, we would suppress the wood element, which is in control of the earth. So we would sedate the wood point on the spleen meridian, which is spleen 1, and also the element or house point on the wood meridian, so the liver meridian, and this is liver 1. So for the controlling cycle aspect of the 4 points, in that case, we would sedate spleen 1 and liver 1. And in this, according to this scheme, we will get 12 point combinations for the tonification and 12 for sedation. And as I said, 2 points are selected according to promotional cycle that followed that very famous saying of Nanjing, chapter 69, in case of deficiency, tonify the mother, and in case of excess, sedate the son. And 2 points that are related, as I just explained right before, to the controlling cycle that was added by Master SaAm. So therefore, we get like 2 charts with the 12 meridians for the Chongyok's or tonification prescription, where always 2 points get tonified and 2 points get sedated. Let's make an example. As we spoke about the spleen right before, we will tonify spleen 2 and heart 8, and we will sedate spleen 1 and the liver 1. And according to this logic, we will have these point combinations for tonification. And if we follow this logic, we will also get 12 point combinations for the sedating each meridian. I cannot go deeper into this logic. It would take much more time to explain it in detail. We just have to, for my presentation, understand this as a given fact. What is important, as I said before, with those 4 point needle combinations, we can treat on 4 levels. We can pick the point combinations to treat the localized conditions. We can pick it to treat Zhangfu, like standard TCM diagnosis, and we take the tonification strategy for deficient conditions, and we take the excess point combination, the sedating point combination for excess conditions, which means we don't have so many different points for different diagnoses. It's very general, but it works, and it makes SaAm acupuncture for this kind of treatment very, very easy. And as I said before, we have these 2 additional aspects of climatic and mental emotional problem. And the balancing model I introduced right before only applies about the 6G climatic condition diagnosis and the mind path model. And the constitutional typing, therefore, relates to the balancing meridian model. Now, since we spoke about the 6G 5-element balancing model of the meridians, and also how the 4 points in SaAm acupuncture are selected or given. Now let's see what kind of constitutional types we can find in this acupuncture model. First, I want to make a very general statement about Chinese medicine and Korean medicine, or constitutional treatment. Okay, we could say, like, in normal TCM, we basically collect the signs and symptoms of our patient. We identify a disease pattern, like spleen, qi deficiency, or heat in the lung, or whatever, and then select acupuncture points according to treat this disease pattern, basically. Okay. And in Korean constitutional medicine in general, or in Korean medicine in general, and especially in SaAm acupuncture, this 6G aspect, there is more focus on constitutional aspects. So in Korean medicine, you would regard general constitutional characteristics of your patients, and also, of course, signs and symptoms, but combine these two information levels to determine the constitution of your patient, and then to treat more the constitutional imbalance and not the disease itself. And the idea is, by balancing the person's constitution, the body will be able to heal itself and the disease will be cleared. Okay, now in this 6G model, how do we treat the constitutional imbalance? From these balancing meridians, I think it's a kind of obvious already that you will look for constitutional aspects in your patient that will show for some specific climatic energy excess of the person. So one or two or more of these climatic energies can be found to be in excess with the patient, and we will regard signs and symptoms plus some body type information that we can relate to this 6G 5-element combination. And we can stick to these 3 dimensions that I talked before: temperature, dampness, temperature, and the dimension of wind or movement. And basically, the most general approach is, has my patient in general too much dampness, or is there too much dryness? And the most general aspect is the patient overweight, or is the patient skinny and thin? Yeah, overweight people being damp and skinny people being dry. And for temperature, we could look at, does the patient have a lot of symptoms and signs that point to being cold or to being warm, or just in general, is the patient easily freezing, or is he always warm? Can they tolerate cold or warm temperatures better? So very general way to look at the patient as a constitutional idea. And for the dimension of movement, it is a little bit more complicated, and I cannot go much into detail. It refers basically to the dimension of wind, and there are several aspects that relate to the movement and direction of qi and blood. So does the patient have signs and symptoms of wind? Does the patient has a lack of energy, drive, or vision? In some understanding, this also relates to having a lot of wind. If you have a drive and energy, and if you lack it, there might be a lack of wind as a constitutional attribute. Does the patient has loss of liquids or has a problem to relax? Okay, loss of liquids, as I said, the wind energy is assumed to be astringing, so to be holding liquids inside the body. So if the patient loses some body liquids, we can say it's a kind of lack of wind energy. And the opposite is for the problem to relax. If the patient is always aroused and under tension and cannot come down, it's too much wind. We also can connect this to the pulse aspect. A livery or wind representing pulse would be typically, like in Chinese medicine, similar, a wiry or urgent pulse. This is just to give you a general overview how to judge the patient's constitution. And I know we'll try to shortly introduce you to several types that we can treat with the 4-needle climatic model. But in general, we will treat by strengthening the balancing meridian of the excess element. It's basically kind of a yin-yang balancing, very basic model. Okay, now let's look at the several constitutional types we can kind of identify from the 6G model. We are now at the level of the 4 meridians that balance each other of Tai Yin and Yang Ming. The lung meridian, having a damp, cool, energetic quality, can balance constitutional types that are warm and dry. What does it mean? It is a more skinny, meager, thin body type frame with signs of heat or a warm body. Okay, that means somebody who has dryness and signs of heat, or has this general slender body build and also has heat signs. We can balance this by tonification of the lung meridian. Mostly I will skip here also for the time shortage, the sedation strategy that can be used. Anyway, the next one is just the opposite of warm and dry. That is a round, damp and cold type. That means people who tend to be overweight, a little bit bulky, but freezing. They might have signs of dampness with cold, also maybe phlegm with cold. And since we balance this with the stomach energy, which is drying and warming, it is particularly useful for people with digestive symptoms, but also for any other problem that is related to this constitutional type, or also related to signs of dampness with cold. We can use tonification strategy of the stomach. As we said, the spleen climatic energy is pure dampness by this combination of Tai Yin and the earth element, and therefore we can balance people who are very slim, meager and dry, maybe a kind of yin deficient type also, but they might have also some coolness in their signs and symptoms, or they are generally freezing. That means skinny, meager, slender, emaciated, maybe yin deficient people who are freezing. They might have a stagnation of fluids because the spleen is too weak, but combined with symptoms of dryness, we can balance this type by boosting the spleen climatic energy. And very obviously, the opposite is the large intestine, being pure dry energy, but as it is associated with the metal element, it is also somewhat cooling. So we can balance body types that have dampness, heat, or a little bit or some turbidity in their constitution. That means in general, overweight, bulky body type that is warm and sweating and has signs of dampness or damp heat or phlegm heat, something like that. Yeah, we can balance it very general. It is not in general in this model. It is not so important to look at individual diseases. Where is it in the body? Which Zangfu is affected? Something like that. We can find such a constitution and balance it by that. I'm sorry, there is not much time to make many clinical examples. Okay, let's move on. This is the Shaoyin Tai Yang meridians. And the heart Chongyok is pure heat, so we can balance body types that show a lot of cold symptoms, that people that are freezing, cold hands, cold feet, freezing a lot, must drink warm, must use warm drinks, do not like the winter time, and so on. The follow-up of very cold people can be problems with blood circulation and blood stagnation due to cold, or pain due to cold. We can balance this by boosting the heart meridian. Urinary bladder, since it is pure coldness, is just the opposite. We can balance people that have a constitutional typing that is very hot. So multiple signs or marked signs of heat, maybe inflammation, also maybe conditions with high fever. That would be not a constitutional type, but an acute disease, for example. And following heat can also be dryness signs. So the bladder boosting the bladder with this very cold energy can be used to very quickly and efficiently cool down any signs of heat, but also constitutional types that are very hot. Okay, this is not really much a constitutional type, but the kidney Chongyok, as it is representing heat and cold at the same time, we can balance every problem that is related to the kidney with those 4 points that are tonify the the kidney climatic energy. This is very weird because it's different from standard TCM, but these 4 points, always the same, can use to treat kidney yang deficiency, kidney yin deficiency, and also deficiency of kidney essence. So a diagnosis that might be related to the kidney in general is very easy in SaAm acupuncture because we do not have to differentiate between different types of kidney problem. Okay, and as I said already before in my presentation, the small intestine is considered to be related to blood problems. Therefore, blood deficiency in general can be treated by using spleen intestine Chongyok. That means skinny, meager, thin types that are dry and hot and have symptoms and signs of blood deficiency, which is very mostly the case for very thin body types. It could be blood deficiency due to yin deficiency and empty heat. It could be a blood stagnation that is related to yin deficiency and blood heat. It could also be problems of bleeding. So it's kind of a very easy and quick diagnosis very often in SaAm acupuncture. If you have some problem in your patient's symptoms or a general very often typing that goes into that direction, we can just use the small intestine meridian. Okay, the last scheme is for the Jueyin and Shaoyang meridians. The liver is the pure moving, very strongly moving, and also pure inwards astringing and cooling energy. So we can basically treat 2 main kinds of problems. All kinds of qi stagnation and blood stagnation can be treated by using the liver tonification strategy. And since it is inward astringing and cooling, if we have a patient that are losing kind of body liquids, urinary, stools, drooling in the mouth, tearing eyes, too much sweating, that is associated also with some signs of heat, we can apply the liver Chongyok. The Sanjiao Chongyok is also a moving energy, as it is Shaoyang and it is fire, it is warming. So we can treat cold body types with that, especially in the upper half of the body, since the Sanjiao meridian is in the upper part of the body, but it's not applied very often, I have to say. And the pericardium Chongyok is also, again, a special case. First, it is the inward astringent energy that is warming. So for the people who are a kind of a dispensive type, like with the liver, but who have signs of coldness, it is better to apply the tonification of pericardium. And another idea is, since pericardium is taking inward, but related to the Shen and to the heart, the pericardium being the guardian of the heart. In SaAm acupuncture, it is related to memory weakness or deficient memory constitution. So if you have a learning problem, if you forget easily, if there is memory impairment, even maybe dementia, and other such problems, we can apply the pericardium Chongyok. Okay. The gallbladder meridian is related very generally to B syndrome problems. Why is this so? Because in SaAm acupuncture, the understanding of this moving inward and outward, the Shaoyang energy going outward, and the moving energy of the wood element going as a wind inward is like a moving inward and outward moving at the same time. And this relates to flexing and stretching your joints in general. So this is related to muscle, tendon, ligament, joint problems. Therefore, we can apply gallbladder Chongyok to many B syndrome type diseases. But as I said, since the Shaoyang energy is moving outwards, that means there's a tendency to spread outward. It is related more to the more distant joints in the body, which means the smaller joints. Yeah, more outside joints are smaller. The general joints at the torso are big, very solid joints. So the more it goes outward with joint problems, the better gallbladder Chongyok, gallbladder tonification can be applied. And the last and only body or constitutional type I want to introduce is by using the sedation strategy of the gallbladder. This is for people who are very easily stressed or have a lot of stress symptoms. The idea is, as I said, the ministerial fire is related to Shaoyang, and the Shaoyang ministerial fire can flare up. It's a very similar diagnosis, like in many cases in TCM might be the liver yang rising and the typical symptoms that go with it. So a lot of stress-related problems can be treated with sedating the gallbladder, and therefore trying to sedate or diminish the flaring up of the ministerial fire. So people who have stress symptoms like headache, tinnitus, high blood pressure, sweating, hot flushes, blushing, maybe even red eyes that are related to stress in general can be treated very efficiently with gallbladder Chongyok. So these are the constitutional types that can be, how can I say, identified from the balancing model of the 6G and the 5 elements. I want to make a conclusion. Some orthodox full needle acupuncture is a possibility to treat localized conditions, Zhangfu diagnosis, climatic imbalances, mental emotional imbalance, all with the same point combination. Since it gives a very systematic and quite easy possibility to regard constitutional aspects of our patients, there is a clear model where we can take into account our patient's constitution, and therefore this model is kind of an integrative way to treat standard TCM diagnosis and concepts with this more constitutional aspects in clinical treatment all together. Okay, this is the end of my presentation. I hope you enjoyed hearing about some aspects of traditional Korean medicine. 고맙습니다, 여러분.